Surgical leadership is essential for addressing resource shortages, improving access, influencing policy, considering sociocultural factors, and scaling up services effectively. Many healthcare systems struggle with inadequate resources, inconsistent infrastructure, and discouraged communities. Strong leadership is crucial, especially in LMICs, to manage these challenges and ensure quality patient care. Issues include inadequate resources, inconsistent infrastructure, and discouraged communities. Leadership is crucial, especially in LMICs, to manage high patient care demands. Effective leadership in surgery requires a solid understanding of key concepts. Leaders must recognize different types of authority, the traits that define strong leadership, and various leadership styles. They should also be familiar with organizational structures and how power dynamics influence decision-making. Additionally, managing conflict effectively is essential for maintaining a collaborative and productive healthcare environment. Surgical leadership plays a vital role in strengthening healthcare systems. Advocacy, innovation, and collaboration are key to overcoming challenges in surgical care. A strong leader understands the system, plans strategically, listens actively, prioritizes team and patient needs, leads by example, fosters collaboration, and effectively advocates for their team and institution. The best leader uses different strategies according to the situation and the individual staff members. The leader will be authoritarian and democratic, develop consensus and be permissive as required to achieve necessary objectives. Authoritarian leadership is reserved for high-stakes scenarios. However, it should not be used in all situations, or followers will likely become disgruntled. Effective conflict resolution requires identifying key individuals, engaging all parties, listening actively, and finding common ground. Aligning solutions with shared goals and using established resolution processes ensures smoother outcomes. Implementing new surgical techniques. The department head ensures all surgeons agree before adopting a novel procedure hospital-wide. Changing post-operative care protocols. The surgical team collectively decides on updated guidelines. Selecting new surgical residents. The entire faculty reaches a consensus on candidate selection. These practices highlight the importance of mentorship, autonomy, and innovation in surgical leadership. By balancing guidance with independence, surgical departments can nurture skilled, confident, and forward-thinking professionals. It's important to note that effective surgical leaders often adapt their style based on the situation, team composition, and urgency of the task at hand. Organizations have established norms that leaders must navigate. Successful leaders understand past structures, integrate effectively, and address harmful practices while fostering positive change. Effective conflict resolution requires identifying key individuals, engaging all parties, listening actively, and finding common ground. Aligning solutions with shared goals and using established resolution processes ensures smoother outcomes. Effective conflict resolution requires identifying key individuals, engaging all parties, listening actively, and finding common ground. Aligning solutions with shared goals and using established resolution processes ensures smoother outcomes. If conflict cannot be resolved, dismissal or transfer of troublesome individuals may be the only solution. Leadership is a learned skill that can be developed over time. The ultimate goal is to ensure high-quality surgical care through effective leadership, teamwork, and strategic decision-making.